All right, welcome everybody back to our series on the PPRP, the Pediatric Pre-Hospital Readiness Project, and specifically the checklist for EMS agencies. We are going to be talking about the section of the checklist that covers patient and family-centered care in EMS. I think this section, when I read through it, was a little bit more difficult to assess at an agency or a regional level. And so I'd like to dive into that and go through each element, discussing a little bit about why is it part of this national checklist, and how might an agency accomplish some of these elements. So the first item was that we partner with families to integrate elements of patient and family-centered care into the policies, protocols, and training, which includes one, using lay terms to communicate with patients and families, having methods to access language services for patients who are non-English language speaking, as well as family members that are non-English language speaking. And three, narrating the actions and alerting patients and caregivers when interventions are performed. So can you discuss why are these so important, especially from a pediatric perspective? And what are some ways that an agency knows, A, that they're doing it, or B, how to start doing that if they're not currently?
Yes, so the pediatric population when it comes to healthcare is a little bit different in the way that you, in essence, are not just dealing with your pediatric patient, as we had hinted before, but you're approaching healthcare from a holistic standpoint. So you're interacting with not only your pediatric patient, but their caregiver as well, or caregivers. And a lot of evidence has shown when you include the caregivers into the equation of providing healthcare for your pediatric patient, you improve outcomes, you improve communication. Caregivers provide a lot of information. They know their children best. A lot, depending on the age group, many children are not able to speak yet, or can give you a thorough medical history. And so it's very important to involve the caregivers. Particular populations I think about are the special healthcare needs children, which may have many complications and comorbidities and many medications that we don't normally see in the pediatric population. And caregivers can be very helpful in providing that information for our EMS clinicians to then help better manage the patient. I think in general, some of this stuff that we're talking about is very pediatric centric, but some of it is healthcare centric of, communicating with patients and families based on lay terms. A lot of times I know myself as a physician can get carried away with the acronyms that come with medicine. But I think to best take care of your patient, you need to be able to communicate with the patient and keep in mind, that people come from various backgrounds, particularly various educational backgrounds. And so, the more you can speak in lay terms, the better you can communicate, the better you can take care of your patient. And I don't think that's necessarily pediatric centric in that specific moment, but it's pediatric centric in the sense that you, in essence, need the caregivers to help you take care of the pediatric patient. Language access is a little bit harder, but what we know from a census standpoint is the United States of America is at its most diverse population that it has ever been, and is increasingly becoming more and more diverse. And so in many of our jurisdictions where we may have not have started out with immigrant populations or populations from other ethnic groups speaking other languages, what we're finding now in the more recent years is we're having more and more diversity pour into our communities. And so able to provide high quality centered care, we need to have language access services. Now, I know for many EMS agencies and services, this may be very difficult to have or be part of your budget, but if you have those services, it's best to use it. I think lastly, you would use a family member if you're in dire straits and you really need to be able to communicate about your pediatric patient. But in essence, you would want to use a third party language service or moderator to help you with that. Again, all of these help out with outcomes in the end of understanding what your patient is going through, what is happening, and the concern of the caregivers. And then also, again, you're not just dealing with your pediatric patient, but in understanding, the pediatric patient and developmentally their understanding of the healthcare system and how they're being cared for, it's good to understand from a developmental standpoint, you know, what kids expect and what kids need. For instance, school-age kids understand cause and effect, and so it's good to talk to a school-age kid about what you're about to do, not lie to them. That helps to go a long way in the treatment process. At the same time, it's helpful to let the parents know what's going on or the caregivers to know what's going on to alleviate additional anxiety and stress. So, I mean, you're right. As far as a measurement, it's pretty difficult. I think what's key here is that EMS agencies begin thinking about this as part of their practice in the way of patient and family-centered care, even if they don't have it in their policies and protocols or training now, to begin to think about that and integration of the healthcare of the pediatric patient.
Yeah, and just one comment, one thing Dr. O said, I think it's really important that you pre-plan, that you have resources you can access. So, in an urban area, we have a fairly large immigrant and refugee population. So we have different areas of the city. We know that hey, there's a lot of people that speak a certain language and don't speak English. So most 911 centers or PSAPs have access to translation services or the language line. So it's important to just reach out to your 911 call center and see what those resources are available and what number to use to call into that. You can also use Google Translate. There's a language line. Sometimes within cities or communities, they do have an individual that will speak English and they can get you in contact with the person. So I think, identify what your populations are and have a pre-plan for that so that we can communicate, figure out what's wrong, and solve problems.
Yeah, I think Chief Pinchalk brings up a great point. I think sometimes we forget about 911 and dispatch as a resource. But having talked to some of the national leaders in dispatch and 911, many more of them have language services available in a lot of the jurisdictions throughout the country. And I wasn't aware of that myself. And so you might be surprised. You might assume that in your jurisdiction, you might not have that service available to you, but it's worth connecting with your dispatch folks to find out. And to Chief Pinchalk's point, pre-planning. I think some of the policies and procedures, there are examples here of like family presence during resuscitation. That goes a long way and is very important to have. The practice of cultural and religious customs. If you watched our previous segment, I used Ramadan. We're currently in the season of Ramadan as an example of medications that could be used during Ramadan or not used. And just being aware to Chief Pinchalk's example of what are those cultures in your community and what may be some practices that may affect how you provide healthcare for that particular patient. Being aware ahead of time may kind of clue you in. And then particular for pediatric patients, maybe very important and helpful actually to have a family member or guardian to help during transport to alleviate the anxiety and fear of the child and help to better manage the child. Again, keeping in mind safe transport practices in regards to that as well.
Yeah, I think these are particularly interesting because I think these are some areas where you can have a policy or send a memo or say I have this resource. But I think part of this assessment, since these are right, these are things implemented by EMS clinicians in the field at the point of contact with care, just like all of these assessments. I think this checklist is about truly are you pediatric ready, which means not do I just like have the policy and I check the box, but as the person who's taking care of the patient, are they aware of it? Do they know how to implement it? Right? Like, I might have a language line, but nobody knows how to access it. That doesn't actually impact the care. So I think with each one of these, and I think particularly with this one, right, about things like family presence during resuscitation, or how do you communicate with somebody with a language barrier, or what do you do sort of with transport parents? I think you need to really be talking with the frontline clinicians at your agency and saying, not do I check a box up on high, but is this something where there's some shared mental modeling or people feel prepared to do these things where they know they're allowed to do these things. And if not, how can you help them? And I think there's some really good resources that are in the toolkit that accompanies this to sort of start the conversation, if not. So that is talking about patient and family-centered care in EMS. Thank you, and we will be back with policies and procedures.